Clindamycin is something I know you've heard of. Its trade name is Cleocin, but absolutely clindamycin is something that you're going to give throughout your career, okay? So its indication is for skin infections, respiratory tract infections, septicemia, intra-abdominal infections, and osteomyelitis, okay? So if you work in the hospital in any sort of capacity, you're probably going to give this because you're going to see respiratory tract infections, sepsis, skin infections throughout your career. So what does it do? Well, first of all, its therapeutic class is anti-infective. Its action is that it actually inhibits protein synthesis, okay? So what that means is it's bacteriostatic. Okay, so it just kind of stops the protein from synthesizing and continuing on. So it just kind of stops the bacteria from growing. It doesn't kill it, just kind of stops it, okay? So some of the reasons we're going to give it are pretty broad spectrum, okay? Skin infections, respiratory, sepsis, intra-abdominal, and osteomyelitis. Some of the nursing considerations for this are, like with a lot of antibiotics, we really want to watch out for GI type things, okay? Things like pseudomembranous colitis, diarrhea, okay? So our patients are really can develop this diarrhea as associated from this antibiotic. And so we want to just monitor our bowel function. It can also cause arrhythmias. It can cause phlebitis at the site. We want to assess for the infection like we always talk about. We're going to obtain cultures prior to therapy. And then we're going to monitor liver function tests and monitor our CBC. So this is really just a pretty basic antibiotic that you're going to be giving. It's something to be familiar with. Cleocin, clindamycin, bacteriostatic, watch the diarrhea. And a lot of times what you're going to be tested on in nursing school and on the NCLEX are just the importance of grabbing your cultures prior to starting therapy, okay? You never want to start your patient on something, start to control the infection, and then grab your cultures. It's kind of too late then, and we can't, if we start on this broad spectrum and start to control that, we never really figure out what was going on, and then we can't really dial down the antibiotic that we're giving, okay, and really target the organism that we're trying to get rid of. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.